According to research, more than 90% of deaf children are born to hearing parents who experience stress not only in response to the initial diagnosis, but also in adapting to the unique needs of their deaf child.
Okay, Michaela was living in Durban, and when she was diagnosed deaf when she was 1 year old. And then I heard about the cochlear implant in Bara, the first operation. So I brought her and came up, and I went to the procedure, and she had an implant only when she was 3.5 years old. But after the implant, it was a hard struggle because she couldn't hear and talk before 3.5 years.
How has the implant changed Michaela's life?
After the implant, with the help of the audiologist in Baragwanath Hospital, she started picking up words and hearing sounds and putting them together. And it was a hard journey of life.
It was indeed a hard journey of life that was suddenly changed by a cochlear implant. However, there are millions others who are still on this hard journey of life, living with hearing loss. Now, according to the World Health Organization, 466 million people globally have disabling hearing loss, and sadly, 34 million of these are children. Now, unless action is taken by 2030, there will be nearly 630 million people with disabling hearing loss. And by 2050, this number could rise to over 900 million. Now, World Health, or at least World Hearing Day 2018, was celebrated on the 3rd of March, and the WHO drew attention towards the anticipated rise in the number of people with hearing loss across the world with the theme, Hear the Future. So today we unpack what you need to know about hearing loss. Now, to help us do this, we have an expert panel comprised of an ENT surgeon, a speech therapist and audiologist, the Deputy Director and Director of the National Institute for the Deaf, a cochlear implant beneficiary, and a mother of a cochlear implant beneficiary. Now, we invite you to be part of the show by asking the panel some questions or just simply sharing your views with us. The number to call in that case is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk, or simply just interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead, coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk.
At MedShield Medical Scheme, we don't just talk health, we do health. SMS MedShield to 33023 or talk to your broker to get your kind of care.
South Africa is in need of a frank dialogue. My name is Onkgopote JJ Tabani. Join me every Sunday at 8:30 on SABC News Channel 404 as we speak to leaders of society, business and government about the state of our nation. Come now, let's talk frankly.
Exclusion from communication can have a significant impact on a person's everyday life, causing feelings of loneliness, isolation, and frustration. While young children miss the critical language learning period, adults are unable to access or maintain their employment status and support their families. It is for this reason that Chris Hani Baragwanath, the third largest hospital in the world, developed a state-of-the-art cochlear implant program in Gauteng.
Prior to 2006-2007, it was only available to private patients who could afford it. But in 2005-2006, Dr. Rahman approached the audiology and speech therapy department at Chris Hani Baragwanath Hospital and said perhaps it's time for state patients to get these implants as well.
Started in 2006, this largest funded South African program has benefited at least 100 patients. 11-year-old Michaela Naidu is one of the beneficiaries.
When I was a baby, I didn't talk and hear. When I was 3 months, I got Cochlear. I can play, I can write, I can read, I can talk.
According to the World Health Organization, hearing loss is the most prevalent disabling condition in the world, affecting at least 360 million people. In South Africa alone, close to 2 million people over the age of 5 are living with hearing difficulty, and more than 250,000 of these people have extreme difficulty in hearing. More than 6,000 babies are born with permanent bilateral hearing loss every year in South Africa. What are some of the causes of hearing loss?
Most of our adults have lost their hearing due to TB treatments, which results in an ototoxic hearing loss, which damages the inner hair cells. Some of our children are born not hearing. Some of our children have contracted meningitis, which then affects the hearing.
While learning sign language can bring some relief to people experiencing severe bilateral hearing loss, as hearing aids are not sufficient, a very expensive cochlear implant that costs more than R250,000 is the only hope available to gain access to sound. But most medical aid companies do not cover the cochlear implant.
I think it's mainly the cost. There are a few medical aids that are very good about it and have a supportive program for cochlear implantation. But by and large, a lot of the medical aid schemes are not funding it. One of the reasons is the cost of the implant. It's quite an expensive instrument, and unfortunately they feel that it's too expensive for them to fund. But I think that if they knew how much it makes a difference to people's lives, they would change their minds.
How effective is the cochlear implant?
At Chris Hani Baragwanath, as you know, we've done our 100th implant, and I've done a few more elsewhere as well. So that's been a tremendous privilege for me to be able to do this, to see the patients recover from it, and to have them respond to the implant has been a great achievement. To me, it's just a privilege to be able to do that, and I'm overwhelmed.
All right, so to help us, discuss this issue of hearing loss, it's a great pleasure for me to welcome our guests in studio. First up, the gentleman closest to my left, Dr. Razvi Ahmed, who is an ENT surgeon and the clinical head of the ENT department at Chris Hani Baragwanath Hospital, and also, of course, director of that cochlear implant program at Chris Hani. Welcome to Health Talk, Dr.
Thank you, Stella.
All right, and next to Dr. Ahmed is Natalie Rulovse. Natalie is the Deputy Executive Director of the National Institute for the Deaf. Welcome to Health Talk, Natalie.
Thank you very much, Doctor.
All right. Dr. Ahmed, we're going to be talking about everything around hearing loss, and of course, lastly, talk about that program, the wonderful program that you've established at Chris Hani Baragwanath. But before that, I think let's start with the basics. What do we mean when we say hearing loss? And some people rather use the term deafness. So just take us through, the basic definitions of.
Okay, I think generally hearing loss is just a lack of perception of sound.
Right.
And that can vary from mild to severe, profound to complete. Mm-hmm. And I think when people talk of deaf, I think they mean more people who are severe to profoundly hearing impaired.
All right.
And so that's generally.
Perhaps it might be great for us, at least for the sake of our viewers, to just have an idea of how the normal ear works, or at least the concept of hearing. How do we hear sounds? People tend to see this outside, what we call the pinna,
yes.
and think that's it. This is all about the ear. Just take us through what the normal ear does.
Okay, so basically sound waves travel towards us.
Yeah.
Our ears pick it up. Our ears are made up of 3 different components.
Right.
It's the outer ear,
Right.
the middle ear.
As we're showing in the screen now, yeah?
That's right, and the inner ear.
Right.
So the outer ear is composed of the pinna and that little canal going up to the eardrum.
Right.
The middle ear is then composed of the 3 ossicles, which most people in school learn about as the hammer, the anvil, and the stirrup.
Right.
So, and then that goes into the inner ear, which is mainly made up of the cochlear, which is almost a shell-like structure.
Right.
That has fluid and hair cells in it that perceives the sound
Yeah.
and transmits it to the nerve, which then takes the signal to the brain.
To the brain. Okay. So obviously the sound goes through all of this that we ultimately interpret as, you know, either a monster coming or whatever the case might be.
That's right.
All right. So we obviously now are talking about hearing loss or deafness. Perhaps let's invite comment from Natalie. How common? First up, tell us about the National Institute for Deafness.
Yeah, firstly, the National Institute for the Deaf started in 1881, so it's 137 years ago, mainly to support people with hearing loss or the deaf at the time,
Right.
with education, training and care, and also support services to help them around.
Okay.
So that's where we started. We still not stuck to that, but that's still what we're doing,
Right.
helping people with hearing loss across the broad spectrum, from as Dr. said here, from mild to severe to,
Yeah.
and also the full spectrum of hearing loss, not particularizing any group or grouping.
So you're then better placed to tell us about prevalence then, you know, how much of a problem is hearing loss in South Africa?
I think it's bigger than people will think, simply because there's a lot of people that's been affected by it. We know from childbirth, youngsters, it's across the board, from all people, all walks of life, all ethnic groups. There's not a particular one that's about other than the rest.
Okay.
But a very important thing is that it's the perception of the public.
Okay, we're going to come back to that.
Yes.
Let me just invite comment from you. Do you have figures, actual figures for South Africa? I mean, we talk of 466 million globally. Do we have, the actual figures for South Africa?
South Africa seems to indicate that there's about 3.2% of South Africans who are hearing impaired.
Okay.
So about 1.8 million. But I suspect that that's underreported.
Right.
Many people don't get in and inform, and so I think it's much more than that.
Okay. So just take us through different types then of hearing loss.
Essentially we would divide it broadly into 3 categories.
Right.
Conductive hearing loss, sensory neural, and a mixed hearing loss.
Right.
So the conductive is, as I was saying, in the outer and the middle ear, anything that obstructs hearing going to the inner ear, that would cause a conductive. So it would essentially mean that the inner ear is functioning. So if we amplified sound, it would get in and you would hear.
Right.
The sensory neural is divided into sensory, which is the cochlear inner ear component, and neural, which is the nerve. And any of the things that affect those would then cause a sensory neural.
Right.
And then obviously there's the mixed, which is a combination of both.
Okay, so how common, perhaps let's just stay with sensory neural, because that's what we're going to be focusing on a bit later. How common is that as compared to all other different types?
We don't, once again, we don't have figures for it,
Right.
but a large proportion of that 1.8 million is actually sensory neural.
Right.
In fact, we don't add conductive into those stats at all, because those are treatable.
Right. So in terms of clinical features, I mean, you've already mentioned that it's basically inability of people to hear and perceive sound. You know? So, and of course, there's different grades, as you just said. But what causes all of these?
Well, there's a number of factors. I mean, it can be people who are born with a hearing loss, and that can be because of any problems during pregnancy of the mother. So infections during pregnancy, rubella being one of the main ones, other problems during pregnancy. At birth, if there are any problems during birth, or hypooxygenation during the birth period, jaundice, high oxygenation in ventilators, a whole host of things, or that they were inherited. So there are a number of hereditary factors that can cause hearing loss. And then there's the acquired form, which can be divided into a whole host of features. So trauma, infections,
neoplasms, so tumors, autoimmune, and then a large proportion of which are called idiopathic, because we never really know what caused the hearing loss.
Right.
So there's a
now, in terms of the
variety
difference
factors
between children and adults,
Okay, mostly adults generally have acquired hearing loss. So at birth and during childhood they were hearing, and then something occurred, either an infection, noise, large noise, trauma, any of the other neoplastic tumors. Those caused the hearing loss, and then drug medication even. So side effects to some of the medications, especially to our anti-TB drugs, can cause hearing loss.
All right. Natalie, you mentioned earlier issues around perception. What sort of advocacy work do you do around that? And do you want to perhaps just expand a bit?
Yes, I think firstly is that the general public doesn't really understand, because sometimes the children will perceive it as my grandfather is deaf, but they just have hearing loss, so they don't see it as that serious, etc. And the big thing is, when they do get in contact with a person with hearing loss, or a deaf person per se, they are actually more afraid to communicate with them, because they don't know how to react, more than perhaps a deaf person. So the general public, they're very much unaware of what exactly it entails, and the effects thereof.
So what sort of programs do you have in place to try and address that?
Well, sensitization and awareness programs which can differ and on different levels, also according to the time that you've got available. So it can be a very short one just to sensitize people, but it can be a 3-hour or a 2-day workshop that's been done, delivered to the public to make them aware and to sensitize them, especially in the workplace where we place students. They have to be sensitized, otherwise they don't know what to expect, and they can cause trouble.
All right, so time for a quick commercial break. When we come back, we'll try and understand the impact that hearing loss has on our society. Please stay with us.
Shield Medical Scheme, we don't just talk health, we do health.
Dose of art and entertainment news. Tune into Trends every Saturday from 12 to 1.
Welcome back. We're talking hearing loss with our guest, Dr. Rabzi Ahmed, ENT surgeon and clinical head of the ENT department at Chris Hani Baragwanath Hospital. And joining us is two other special guests. First up is Sibongile Mbata. Now, Sibongile Mbata is a cochlear implant beneficiary that she's received from Chris Hani Baragwanath Hospital. Welcome to Health Talk, Sibongile.
Thank you very much.
All right, you're going to tell us a little more about your implant, but let me introduce the next guest, who is Norama Fokate. Makofane, my apologies. Norama Kofane is a mother of a cochlear implant beneficiary. The name Montati, of course, that's the child. Welcome to Health Talk, Nora.
Thank you very much.
All right. First, let me start with you, Dr. Ahmed. Clearly, having worked with, children, adults, the wide spectrum of people with different types of hearing loss, the impact can be quite devastating. Just a touch of what you've seen.
Well, essentially, when you see these families at the beginning, they're all traumatized.
Right.
Because either as adults they've lost their hearing suddenly or over a period of time and can no longer communicate. And parents who come in with their children feel almost dissociated from their kids because, again, it's very difficult to communicate. So I think it has a profound impact on them, socially as well as psychologically.
Yeah. First, let's hear it from them. Let me start with Nora. Nora, I am told that you have a child, obviously, who's been a beneficiary of this cochlear implant at Bara, but you have another child, you have two other children. One has hearing loss and the other one hears normally. Just take us through your story around Montati. Let's first start with Montati. What happened?
Okay, Montati was born deaf. So Montati got the cochlear implant when he was 2 years old. And then we helped him a lot.
So how long ago how old is Montati now?
Montati is 10 years now.
Okay, so he got this cochlear implant 8 years ago when he was 2.
Yes.
Just take us back a bit. In that first 2-year period,
okay,
what did it mean for you to have a child who couldn't hear you?
It was very difficult. I have the other one who was born deaf. He's 21 years now.
Oh, so he's older?
Yeah, he's older than Montati.
Right.
Okay. I was so scared.
Yeah.
When I found that Montati was also deaf. It was difficult for me.
Right.
I found out when he was 6 years old.
The older one?
Yeah, no, the Montati, when he was 6 months.
6 months,
Yes,
okay. All
yeah,
right.
I mean 6 months.
Yeah.
So I went to the doctor and then explained him that Montati wasn't here. So he told me, what do you saw?
Yeah.
I said, when I bend the door too much, so he can't respond.
Right.
So he took him to the test.
Yeah.
And then he said he was deaf.
Okay.
Yeah.
All right. And obviously, having had the cochlear implant has changed his life.
Yeah, he's changed his life a lot.
So if you compare Montati now, after the cochlear implant, and compare him to the older child who's deaf, what are the differences?
It's very different. Because Montati now it's talking, and then the other one it's not talking, it's signing. And then sometimes the older one is complaining why doesn't have the cochlear implant.
Yeah.
Because Montati was hearing now.
I see.
So it's given me a lot of challenge.
Right.
Yeah.
Right. First, let me invite a comment from you, Dr. Ahmed. In terms of risk factors, I know we mentioned issues that happen during pregnancy, but are there any genetic factors that can lead to hearing loss?
Well, yes. Generally, we don't have the exact DNA that causes hearing, but connection 21 is one of those that we know, and that can occur at any time in your life, that you can lose hearing with one of those DNA abnormalities. But there are a host of other syndromes that we come across that have hearing loss as one of the complications of the syndrome.
All right, let's speak to Sbongile then. Sbongile, you had hearing loss later on in your life when you were an adult. Please take us through what happened to you.
Okay, I lost my hearing in 2011.
Right.
After giving birth to my last born child. So by the time I didn't even know that I was having TB or something. So I just got sick and I was taken to hospital. During the process when I was at hospital, they just explained to me that, you know what, the medication that we've been giving you, it's no longer suitable for you. We are going to start to inject you. So I started to receive injections.
So at the time that you were told the medication isn't good for you, was there anything wrong with your hearing?
No, I was still fine by the time. I started to lose my hearing when I was receiving the injections.
Okay.
So this other day I woke up and I explained to the doctor that I can't hear properly anymore. I don't know what is wrong. And then he just said to me, no, I think maybe it's something else, but we don't know. So at that time they didn't actually give me the proper answer. Until I left the hospital, I started to lose my hearing. You know, it just went worse and worse, and until I came to a point where by now I can't hear. So I went back to the hospital, and then they explained to me that, you know what, you have a hearing loss, and I didn't know what is the cause by then. So they just said we were going to refer you to Baragwana Hospital. To be honest, it was very challenging for me. I didn't understand. So it took me about 2 or 3 years before I can actually accept the offer to go to Baragwana Hospital. I just said, no, it's the medication that made me to be like this. So, I mean, I won't go to Para. It means I'm going to be worse. What if I arrive to Para and they're going to give me more injections? Mm-hmm. So I just stayed at home for that 2 years, it was so difficult for me. I just had a baby. I couldn't hear my child crying at night. I couldn't communicate with my kids. I couldn't socialize. It was the hardest moment of my life. Mm. And until I decided to go back to hospital, and I asked them, so what is the medication that you're going to give me so that I can gain my hearing back? And then they said, unfortunately, there's nothing that you can do anymore. We can just refer you to the hearing department, to the ologist and everything. Then when I went to Lenasa Hospital, then they just said to me, we'll have to refer you to Baragwana. And I went to Baragwana. At Baragwana, that's where I met Dr. Dani and the other team. Then that's when they explained to me what is hearing loss. Mm. It was very difficult for me to accept that because I kept on asking one question. So is there medication that you can give me so I can hear again? Mm. And they just kept on answering me, no, there is no medication for that. They kept on explaining about the hair inside my... there was a lot of explanation. Right. The hair that is inside my ear and is being destroyed forever and all that. And I said, okay, so what can I drink to make that hair to grow again? Yes. Yeah. And by that time, I just couldn't accept. As time went by, then they explained to me about the cochlear implant. Right. When I was in a process, I was initiated with hearing aids. Hearing aids were also frustrating me by then, because I could only hear louder sounds only, like cars. I couldn't communicate still. It was very difficult for me. So my life was a standstill for almost 5 years, because I got my cochlear implant in 2006. Yeah. So for the 5 years, my life was a standstill. I couldn't do anything for my kids. I couldn't work. I couldn't go to school. I couldn't do anything.
And since you've had the cochlear implant?
And I got the cochlear implant in 2006. I remember the day of the switch on. Wow. Mm. It was a miracle of my life, because I could hear my doctor calling my name. And I was like, Sponile, and I could check everywhere. So then she explained to me that, since the switch on, then it means I can hear. Ever since from that day, my life is amazing. Great. I can hear, I can communicate with my kids, I can do almost everything. I'm at school at this present moment to upgrade my life.
Yeah, so wonderful, wonderful story. Dr. Ahmed, perhaps let's just get back to her instance. Yes. I mean, her specific case about, TB medication as a cause. Firstly, how common is that? And secondly, is it something that's preventable?
Well, with anti-TB drugs, the standard regimen doesn't cause hearing loss. The problem in our situation is that we have the drug-resistant TB. Right. And so now they've had to go back to using aminoglycosides, which is a group of drugs that causes hearing loss as one of its side effects. Mm. And so unfortunately, that's one of the problems. When they give these drugs, we know that one of the side effects is a hearing loss. Mm. It's preventable in the sense that if we don't use it, yes, but then the effects of the TB are worse. Mm. So there is a whole host of studies trying to be done now to get an alternative to treat drug-resistant and extreme drug-resistant TB. But at the moment, it's not available.
Did you have drug-resistant TB, Sibongile?
On my side, no, because, let me say yes, because I didn't know it was TB. Apparently, I was not having the chest TB. I'm not sure if it was a stomach or a spine TB, but something like that. Okay. Yes, but it was not a chest TB. Oh. So from the start, I just had to inject. All right. So I think it was MDR. I don't know if it's possible to get MDR immediately from the start.
Yeah, well, I'm sure the doctor can.
Well, there are cases of MDR from the beginning, unfortunately, yes.
So what sort of work are you doing now, Sibongile? I mean, I believe that you are happy to tell your story to a whole lot of other people to encourage them. Is that what's happening now?
I'm at school at this present moment. I started at Sparrow, and then I did my IT course. But now I'm at school. I'm doing sewing we had an organization which is DEFSA, and then it's a combination of deaf people and people with hearing loss. So they combined us together to build one world, because we understood that even if you are having a hearing loss and a cochlear implant, at least you still need to know sign language. Let me say basic sign language. Maybe in case you run out of a battery, or maybe something happens to your cochlear implant, and then you know that maybe there's something that you can also do to communicate.
Well, Sibongile Mbata and Nora Makofane, thank you so much for your time, and I can only wish you the best forward. Thank you so much.
Thank you very much.
Right, folks, time for another quick commercial break. When we come back, we now start talking about prevention. You stay with us.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est si bon.
Yes, yes.
Sports Live every Saturday and Sunday at 7:30 p.m.
Technology is used for both positive and negative.
Some governments block the internet in times of protest.
With this internet blackout, it's impossible for me to do it, so I have to travel to Douala.
This act is a true violation of the rights of citizens.
In Africa, people are always coming up with innovative ways to use technology to solve some of their problems.
The more interesting piece of technology is actually the artificial intelligence.
AI, it's utilizing data to make your life easier.
Our network will give you Africa's technology and social media news.
For all your technology news, join Siphumelele Zondi every Saturday at 17:30.
32 nations, 44 matches live on SABC 1 and 19 SABC radio stations. SABC is the official broadcaster of the 2018 FIFA World Cup Russia.
Welcome back, and thank you so much for staying with us. If you just joined us, we're talking hearing loss with our guest, Dr. Ravzi Ahmed, who's head of he's an ENT specialist or ENT surgeon, head of the ENT department at Chris Hani Baragwanath Hospital. And we still have Natalie on my extreme left, Natalie Rulofse, who's deputy director of NID. And we're now joined by another special guest. Now I'm going to say the name slowly. It's the first name obviously is quite simple, Danny Schlesinger Mishlo, who's a speech therapist and audiologist from Chris Hani Baragwanath Hospital, and of course she's the coordinator of that cochlear implant program that we spoke about earlier. Welcome to Health Talk, Danny.
Thank you very much.
At least I'm glad I don't have to say your surname again. I just got it. All right. We'll come back to you just now. Let me start with you, Dr. Ahmed. We obviously went through the different causes and risk factors and so on, and in any condition we talk about in health, prevention is important, is an important aspect. Let's talk prevention strategies now for hearing loss.
Okay, essentially we're talking sensory neural hearing loss. So Pregnancy, always make sure that your vaccinations are up to date for women who are going to fall pregnant at any stage. Make sure that because rubella, again, is a preventable cause. Right. Make sure that. At birth, you know, usually the doctors should take care of the baby, the infant, neonate, whatever. Make sure that even if they're giving oxygenation or whatever, there's protocols that help prevent hearing loss. And then the other preventable causes, things that cause it, measles, mumps, those kind of things. So again, vaccines, very important for children to have them, because those diseases, as mild as they seem, can cause hearing loss. And so again, that's a big traumatic and mainly noise-induced is a big preventable cause. So protect your ears from loud noises. You know, in loud noise situations, put on hearing protection, earplugs, headphones, things like that.
Well, our teenagers believe a different story, I imagine.
That's right. We have the problem at home.
Yeah, right. Well, Danny, maybe let me invite you in here. I mean, often it's said that the earlier anything is detected, the better. Let's talk about screening for hearing loss. And I mean, that's essentially your department, isn't it?
Yeah, now, that's a topic very close to my heart. Basically, we can pick up newborn hearing loss within a couple of days of birth. We can pick it up at the hospital when the baby is born. And I think internationally there's been a lot of research which has shown that if we can pick up that hearing loss in the first days of life, we can intervene early, get that child into intervention before the age of 6 months. And if we can do that, those children have the potential to develop like their hearing peers, to develop good language, good academic abilities, good reading abilities, have positive social interaction, all of the things we want for our children. But if we don't pick up that hearing loss at birth, we run the risk that we wait until parents notice a problem. And often they're sent to different professionals before they get help, and often the children only get to us at 2 or 3 or 4 or 5 years old. And then we see much more difficult journeys and poorer outcomes for these children. So really, every single child that is born should have their hearing screened within the first few days of life, and there are no exceptions. That is the only way we're really going to turn around and give people those opportunities.
What about school-going children?
So the first point of screening is at birth for early onset or newborn hearing loss. There are obviously hearing losses that then can progress over time. So there are some hearing losses that will only present when the child's in preschool, or they could pick up a condition that would affect their hearing. And so the next point of hearing screening would be on entry into schooling. So at about grade 1 level, again, there are now a lot of schooling programs that are screening children's hearing as they enter into school. But it's still not nationally available.
Natalie, any comment on, you know, the work that you do in prevention, basically?
I think I would just want firstly to add on this for the general public to understand, you know, why this is so important, because language acquisition starts from the womb until about 7 years old. If the concept of language is that, if that's not being said, it's very difficult, if possible, to acquire it later in life. So this is extremely important, and then because in the end it's not only about the hearing loss, it's about the communication that's getting lost in the process. And we are human beings, and that's what makes us human beings, is the possibility to communicate freely. So I just want to add on that. That is so important. So I think from our side, we're not on the medical part, but the screening is extremely important. The other thing is through the sensitization and the awareness, because, you know, years ago, a big problem with adults was what they call industrial hearing loss or deafness. Working in a clang environment, you know, in industry. And nowadays, fortunately for that, you know, health and safety demands that they must take care of it. But now the children from age 10, they will have this iPads and iPods and everything with a lot of music in it, and too loud, too long, too loud. And well, internationally they're actually talking about hearing loss tsunami in the next 5 to 10 years, because, and it starts earlier. So it won't only get to the surface at 40 or 38 or 40, like in the industrial hearing loss, but earlier, 25, 28, then you start, and that hearing loss is what we've heard earlier. You know, it cannot just be reversed. It's very difficult. So that's our thing, is to through school programs, adult programs, and then also in old age homes, you know, to encourage them to use hearing aids, etc., and to also to sensitize the workforce in old age homes or retirement villages, how to work with you know, the elderly, because a study in the United States 3-4 years ago stated that 74% of people older than 70 has a form of hearing loss. It can be mild, it can be severe, it can be profound, it can, you know. So it's so important that and it affects the biggest part of the you know, the people in the country.
All right. Talking about hearing aids and this, let's talk principles of treatment now for hearing loss. I mean, clearly, different types obviously has different strategies and so on. Just take us through.
Okay, for sensorineural hearing loss?
Yeah, we can cover all of them.
Okay, so for conductive hearing loss, it's fairly straightforward. You have the options of either surgical, medical, or amplification. So usually surgery is if there's any abnormality in any of those structures we discussed earlier, either in the external or middle ear, and many of those can be corrected. So that's an option. You can have amplification with hearing aids, or you can sometimes, with infections and that, treat them medically, and you know, if there's middle ear fluid, that can also be managed medically. So those are the simple strategies for conductive hearing loss. For sensorineural, it's much more difficult situation. Yes.
Before we start, let's take Zaitsa on the line from Mpumalanga. Zaitsa, welcome to Health Talk.
Thank you so much. I'm calling on behalf of my husband. My husband is Mr. Mohammed. And actually, I took him to the hospital. I've got a problem with his both ears. And he cannot hear very well. And even without the hearing aid. And at the moment, I cannot speak to him. He can't hear things. And he's 87 years old. So I want to know what I could do, because I tried my best to go back to the hospital and they were changing the hearing aids. But now he's got a problem with the right ear and the left ear.
All right. Thanks for that excellent question, Zaitsa. Any of you want to tackle that?
Well, he's got to get to the health professionals back, and then he'll see the audiologist, get obviously a hearing test done, which will establish what the hearing level is, what type of hearing it is, and then they'll obviously make the initial appointment with us to say whether it can be corrected or not.
It sounds like she's taken the right decision anyway to take the old man to hospital.
If I just add to that, I think if someone has a bilateral hearing loss, ideally they should get hearing aids on both ears for the best results. So the first step would be to get the hearing test and the hearing aids on. In the event that that isn't enough, you know, there are other things that can be done where the audiologist can do oral rehab to try and help him work out how better to communicate, and the family in noisy situations, tips and tricks for communicating more effectively. So it doesn't just end with amplification.
I'll tell you what, I need to hear more about that. But for now, it's time for a quick break. When we come back, we continue our discussion on hearing loss and its treatment, perhaps more about cochlear implants. Stay with us.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Meningitis is a potentially deadly disease that affects more than 1 million people worldwide each year.
Well, it's an infection of the lining of the brain and the spinal cord. And it's caused by a variety of bacteria.
And also, importantly, with fungal meningitis, there's no transmission from person to person.
In South Africa and elsewhere in the world, the ministries of health, etc., have recognized this as an important disease to prevent. And vaccines have been introduced into immunization, routine immunization programs.
It's really important to prevent, and the best way to prevent is to have people know their HIV status, start antiretroviral treatment as soon as possible.
For all your health news, join Health Talk every Saturday from 9 to 10.
nations. 44 matches live on SABC 1 and 19 SABC radio stations. SABC is the official broadcaster of the 2018 FIFA World Cup Russia.
What is a cochlear implant?
A cochlear implant is a surgically inserted device. It has two parts to it. The implant which goes inside and it's put there through the operation. And there's the outside part which is your speech processor, which is what you can see now on her ear. It consists of a coil cable, the speech processor, and batteries that it works with. It works with rechargeable batteries and disposable batteries. The round part is the coil, and it's got a magnet which connects it to the inside parts, the implants. And there's the coil cable which connects the coil, the magnets, to the speech processor. And this is the speech processor, which is what takes the sound in, sends it through to the implants for processing. And then there's the battery, which is a rechargeable battery or can be a disposable battery. On the other side, she's wearing a hearing aid. So a hearing aid is also given to a person with a hearing loss. Anyone with a severe to profound hearing loss generally doesn't get enough benefits from a hearing aid, which is why they get a cochlear implant. So the hearing aid has the actual hearing aid on the outside, and it's got an ear mold which then holds it in the ear and transports the sounds to go through to the ear.
Okay, that's the life-changing cochlear implant. Well, let's continue our discussion on treatment of hearing loss with my two special guests, Dr. Razvi Ahmed, ENT surgeon and clinical head of the ENT department at Chris Hani Baragwanath Hospital, and with him is Dennis Slezhenga-Mishlo, a speech therapist and audiologist. Both of these are director and coordinator of the cochlear implant program at Chris Hani Baragwanath Hospital. Now, before we start talking about this in any greater detail, let's talk to Mavis on the line from the Northwest. Mavis, welcome to Health Talk.
Hello, how are you?
Good, how are you, Mavis?
I'm fine. I just want to ask the doctor. I do have a child. I just want to know if that thing can affect her ears. Last time he was swimming, then she complained about the water which went inside her ear.
Right.
So I just want to know if that thing can affect her ears.
Thank you very much for that excellent question. It's a common thing that happens, yeah.
Essentially, if water goes into your ear and you've got an intact eardrum, there shouldn't be any problems.
Okay.
It's only with a perforated eardrum that water would affect it.
When there's infections.
There's infection, yes.
All right, okay. Perhaps let me start with you, Danny. We obviously are talking treatment principles, and we're focusing a bit more on the cochlear implants. Tell us a bit more about, I mean, you've been at the center of this program at Chris Hani Baragwanath Hospital. Just give us a sense of what this program entailed.
Well, our program was started in September 2006 as the first fully funded state cochlear implant program, and the only cochlear implant program in Gauteng. And so I think it was a very big process to get that program together, because a cochlear implant program needs a large number of different professionals involved, so that each family that comes in gets assessed by ENT, audiology, speech therapy, occupational therapy, psychology, often social work, radiology. So there's a huge team that works together to help work out whether a cochlear implant will be the right option for an individual or not.
Talk about that. So who are the candidates for a cochlear implant?
Okay, so essentially it would be, just in a broad category, it would be people who would be profoundly hearing impaired. And then there's, as Dennis said, a variety of other aspects that we would take into account. So whether it was sensorineural in terms of the nerve, or whether it was the inner ear itself. If it's the nerve, then we often can't do that. There are other options for them, brainstem implants and so forth. But cochlear implants are generally for children who are under the age of usually 5 to 7, but in our program 3 because of the rehabilitation process. And for adults or anyone who's got postlingual, who has language already. As Natalie mentioned earlier, it's the first 7 years of life that you need to develop language. And if in that time you haven't had language development, a cochlear implant at a later stage is not going to help you.
All right. So in terms of access then, I mean, obviously take us through, sort of interrupted you there.
That's fine.
Right?
Yeah, so I think that the process is that families or patients, adults and children, are referred into us or find us because there's somebody with a severe to profound hearing loss. The first step is we need to try hearing aids. We first need to confirm what the hearing loss is exactly so we understand what we're dealing with. We need to try hearing aids to see whether hearing aids are able to give that individual enough benefits. And for many people with milder hearing losses, hearing aids will be enough. If hearing aids are not enough, we need to do scans and assessments to say, do we think a cochlear implant has the potential to give this person access to sound? That's one part. The next part is we need to really spend time with that family to work out what it is they want as the outcome. So, for example, if a family feels that sign language is the option that they would choose, then one doesn't need a cochlear implant for that. We can ensure that family gets access to really good sign language intervention. If that child can learn sign language, they can go to school, they can communicate, they can have that full life with a job and a family and everything else that they would want through sign language.
Right.
But if for that family what they really want is for that child or that adult to access hearing, then we need to talk about what it takes to get a good outcome, because the cochlear implant's only the first step. So they would then need the surgery, which would get that implant into the ear. Then they would need to come for regular programming sessions where we program the device to the day that we switch the cochlear implant on, the person can't just hear. The sound is very different to natural hearing. So there's a long process of programming the device and altering the parameters to maximize hearing. And then most importantly is then the rehabilitation process. So for adults, that's coming to relearn how to use this new sound. It's what we call oral rehabilitation, and it's training the brain to access the new sound. For
and who does the rehabilitation?
That's the audiologists in our program.
Okay, do they all have to come back to Chris Hani Baragwanath Hospital? I mean, some of them I would imagine would come from far.
Yeah, so we have patients from all over the country.
Right.
We offer that service to anyone. It's a specialized service, and so we will offer that to anyone that needs it. But obviously, journeying back and forth is really difficult, and our children need to come for weekly therapy. So that means a caregiver and a child, like Nora, used to come every week for years and years with her son. We have managed to find pockets of real excellence around the country that are of individual therapists who are helping us and supporting us. So, for example, the audiology department at Tembisa Hospital has been really fantastic, and they are doing therapy with many of our children and our adults who are living closer to that side. So we're always looking for resources closer to home for patients.
Right.
But for many, they aren't able to find it. We've got patients traveling 3 hours, 4 hours to us. We are also looking at the option of tele-intervention, trying to eventually work via the internet that we could give support to them in their homes rather than them having to travel huge distances every week.
This is clearly an expensive program. I mean, it was said there that each device would cost anything in around the region of R250,000 rand.
That's right.
Do you have any funders perhaps, or who's funding the program?
Our funds are coming mainly from the hospital, so the Department of Health, and then we have the TB program that has funded many of the patients who have lost their hearing due to the anti-TB drugs. Those are the main funders we have at Chris Hani Baragwanath Hospital.
Any private sector partnerships that you have?
Not yet.
Are you looking at establishing any?
We've tried to raise some funds, but we haven't been successful as yet. Our board at Chris Hani Baragwanath has raised some funds for us, but more for the accessories, batteries, support stuff, that kind of thing.
So
yes.
Just to add to that, I think that initial cost of close to 300,000 rand is the big ticket cost, and we've been really fortunate to get that support through the hospital. But the ongoing maintenance of the devices is very pricey. A repair can cost 9,000 rand. So if you think about what it takes to come up with that kind of money to maintain their devices, that load sits on our patients. And I think that's a place where really, if we could find additional ways to support the patients. Otherwise, you have a patient who's got their hearing and something happens, they lose their job, their circumstances change, and suddenly they can't maintain their device.
I mean, finally, we clearly are not meeting the needs. You want to comment on that?
Absolutely. We're away from meeting all the needs. We have already a waiting list of 120 patients at Chris Hani Baragwanath, and I don't think that even touches the surface of the patients who require it. And these are patients who have some facilities and some income to be able to maintain it. The others, we don't even have.
Sure. Well, gentlemen and lady, it's been such a pleasure chatting to you, and thank you so much for your time. I can only wish you the best going forward, and I hope that you are able to establish some partnerships and get some sort of funding into the program and get it expanded. Well, folk, it's on that note that we come to the end of our show today, and thank you so much for staying with us. Thank you for all the calls and the tweets. We see you again next time, next week, same place, same time. I'm Dr. Solomon Daung, and until then, please do take care.
If we're talking health, then let's talk seriously. MedShield, embracing our members in good health since 1968. At MedShield Medical Scheme, we don't just talk health, we do health.
SABCnews.com is your one-stop digital portal to all the news you need. With a website that is easy to use on mobile, SABC News prides itself in being the primary source of public service content across multiple platforms. Watch live streams of all the big news events on the SABC News YouTube channel, which is one of the most viewed South African YouTube channels globally. And catch up on the best of SABC television and radio news. Follow breaking news on all of the SABC News social media platforms, interact with SABC News on Facebook, and stay connected on Twitter for the latest headlines and real-time updates by our reporters. SABC News, everywhere.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well. If we're talking health, then let's talk seriously.